Are you feeling extremely tired lately? Or is your body acting different? These may be signs of pregnancy, and some of them are nothing like you expect. Let's talk about some clues your body gives you way before a test could say positive. One, missed period. You know, the most common sign of pregnancy is when you have missed your period. When days have gone by and it should have come some time ago. Why isn't it here? Even though we accept that sometimes your period makes changes, there can be shifts here and there, but um, this kind of shift is significant, and you can tell for sure that a period hasn't come, and it doesn't look like it's coming. So it's a common sign, even though it's not the only sign. Okay. There are times when you might have, after conception, you might have light bleeding and assume that that is your regular period. Through observance, you should be able to tell by now what your menstrual flow looks like compared to just light traces of blood. Two, fatigue or extreme tiredness. Do you feel exhausted even after a good sleep? It's probably because your body is working overtime already in order to sustain this new human life that is has been cooked up within you. Three, tender or swelling breasts. Another common sign is tender breasts, sore breasts, sometimes a little tingly feeling in the breasts. And this sign is also related to um, menstrual periods. Your breasts feel extra sensitive, but this time you know that you probably don't have the period. Do not mistake it to be premenstrual signals. Usually, it this is what you get during the your menstrual period, not before. Well, we're all different, but you know what your body is like when you're on your period, when you're done with your period, or before your period. And so, any slight changes you should be able to tell, and then we could take action. Nausea or food aversions. That's four. Classic morning sickness might show up as early as 2 weeks into conception and does not have a timetable. Um, some people could tell you, oh, well, it will only last through your first trimester. Some people would say, oh, it would happen this way or that way. But it, everybody is different. I can tell you, I can tell you for a fact from experience that morning sickness does not come with a timetable. Morning sickness does what it does. It could come in the morning, it could come at night, or it could last throughout pregnancy. You just need to know you're different and your own experience might just be tailored to you. So, once you feel nausea when you're not exactly sick, uh, nausea accompanied by all these other clues, that I've mentioned, it should tell you that you're pregnant or that you might be pregnant. Um, you would also find that there are times when food that you used to love, all of a sudden you hate, or you do not have the appetite for food at all. There are times you even hate the smell of food. I've heard of stories where um, people started craving for things that they otherwise would not eat. So just study the shifts in your body. If you start feeling like, no, there's a difference, you should be able to tell. 5, frequent urination. Necessary evil. So, pregnancy naturally increases blood flow to your kidneys, and this causes you to have the urge to pee more. Yes, it is irritating. You want to pee, and when you've got to go now. It's not a pleasant feeling, but once you feel this difference, this new sign in your body, chances are you may be pregnant. 6, we have mood swings. Mood swings. So, hormonal changes in the body could cause you to, one moment, feel happy, and then the next moment, extreme sadness. You know yourself better, even though in some cases you might not notice it, the people around you start to notice, why are you acting up? Why are you, why are you being different? This is something you didn't mind people doing around you your entire life. All of a sudden you hate it. You know, when things like this start happening, you should start to be suspicious. 7, we have light spotting. Some people experience light spotting um, during the period of implantation, when the your fertilized egg is trying to attach itself to your uterus. There's a difference between this and then your regular period. Your regular period may be deeper and thicker. This might be faint and will last for a shorter time. 8, mild cramping. Mild cramping is very normal in the first phase of pregnancy, because your uterus is trying to get acquainted with this new process where where the activity of a new human is forming within your body. And so that's how your body adjusts, unless of course this cramping is very severe, then you need medical attention. So 9, heightened smell. This could be very unpleasant, and this could be very irritating because because your sensitivity causes it to be excessive. You're you're perceiving smells more, and that could be a little uncomfortable. But this is all due to the work of your hormonal activity within your body. Yes. 10, bloating or constipation. Typically, in the early phase of pregnancy, food digestion becomes slower, very slow, and so you find that um, you're often constipated, or you feel bloated. If you're experiencing a few of these signs, grab a pregnancy test. or talk to your doctor. Remember, every woman's body is different. Just trust your gut. And if you want more honest and helpful videos on pregnancy, periods, women's wellness, hit the subscribe button, like this video, and join our little community.